From Buffalo Toronto Public Media and WBFO, this is What's Next. Today, we revisit a standout conversation heard on a previous episode.
Black lives matter. Saving black lives, is important. And, preventing the next generation of youth from becoming replacement smokers is critical, to our history, to our country, to our future. We cannot say that health equity matters if we don't address menthol tobacco, if we don't remove menthol, from the shelves.
Public health advocate and founder of Stan Martin Consulting, Stan Martin, alongside the Director of Training, Content, and Development at Roswell Park Comprehensive Cancer Center, Sara Pearson-Collins. They sat with Thomas O'Neill White to discuss the reasons behind the idea of a ban on menthol tobacco products and quitting tobacco solutions.
Tobacco use, specifically menthol cigarette use, has been ingrained in the black community. We know that menthol is more addictive than non-menthol cigarettes in some cases. What is the history behind menthol products being sold and pushed in the black community? Stan?
When we look at historically the appropriation or misappropriation, how you want to frame it, in regards to menthol tobacco, at the root of your question is the African Americanization of menthol tobacco in the black community. One of my mentors and colleagues, Dr. Gardner, he liked to frame it as this in terms of in the early 50s, less than 10% of African Americans or those who identify with the black diaspora smoked menthol tobacco. Then fast forward, or even in between there, today, 85% of African Americans who smoke menthol tobacco. And the reason being, over that period of time, there was free marketing, or I should say free giveaways, the Lucy cigarettes, the sponsorship of different festivals, concerts. I'm dating myself a little bit when you think about the Cool Jazz Festival for some of our listeners. That was about menthol. So that was about really, really trying to mask a business and organization that produces a product when used as intended, kills people. And, it was successful.
Yeah. I think if we're looking historically, it can be traced. So tobacco itself can be traced all the way back to slavery, a crop. It was a crop. Mm-hmm. And so, when you think about your ancestors, how they grew it, they picked it, they smoked it, because the access to it. And so I think it starts further back than just, of course, in the 1950s, there's this big promotion for the menthol piece of it, but even just tobacco itself being traced all the way back, into the 16, 17, 1800s.
Absolutely.
And Sara, You've got your own family history with tobacco.
I do.
And you wrote a really powerful op-ed in the Buffalo News. Do you mind sharing?
Yeah, so I think that I've watched my family smoke for years. I don't even know how I even got here, being a tobacco advocate, but I'm thinking back as far as being a child and attending family functions and having a great time, in the kitchen would be coffee and cigarettes. And they're just smoking one after the other. And you watch it, but you don't really pay attention. And some of the younger kids would go and steal cigarettes and they go back, in the back and smoke. And so this was like part of the family dynamics culture. That's how they communicated. That's how they socialized. And it wasn't until later in the 1990s that you actually started seeing the harm that came from the cigarettes, with a lot of my family members getting sick and then dying ultimately from tobacco-related diseases.
Now, is that what kept you from smoking? Just the understanding that this is going to cause this, and this?
I don't think I even paid attention to the fact that it was causing you to become sick. When I was younger, like the smoke itself was so irritating towards me. Like I have allergies. So I couldn't be in this space with them for long periods of time. We would sleep at certain houses where I went to the houses that didn't have the smoke because it would really affect me physically. So
and that smell,
I just stayed away. I don't like the smell of it. And just, my eyes would be running and coughing and hacking. And so I just kind of stayed away from it. And I guess that was a deterrent. My parents didn't smoke either. So it wasn't something that was condoned or even, an access to it in our household. I mean, I think everybody tries it when they get into college for 2 seconds. For 2 seconds, and then you say, "This is
the
dumb."
peer pressure is real, right? You know, and Sarah, thank you for sharing your story. And I think one of the things I would really also like to highlight is that what Sara was also speaking to is the normalization, of tobacco use in the Black community, and how it was heavily marketed, how it was advertised. Whether, remember in our households, you could be sitting around, or in the living room, you might see, Ebony or Life or Jet magazine, and the amount of advertising, tobacco advertising that was in magazines at that point in time. Or if you're, traveling through the community, going to the grocery store or to and from school, the enormous amount of tobacco advertising on billboards to and from school or to the grocery store. So, seeing those slogans, alive with pleasure, or showing or promoting a lifestyle that people aspire to be and to live, and the tobacco industry capitalizing on that and say, this is a way that we can infiltrate, the Black community. This is a way that we can promote, our poison, our product, to normalize its use. And that's a part of the whole strategy as well.
And it's specifically menthol cigarettes. Because I remember reading a Jet, reading Ebony, and seeing those menthol cigarettes as opposed to, reading like a Sports Illustrated or something that's like Marlboro or Camel or something like that.
Absolutely.
Really interesting to look back on that. Stan, can you tell us about the work you've done both with CAI, which you no longer work for, and also outside of CAI?
Absolutely. I've been very fortunate to work with, tremendous individuals such as Sara, who's here with us today, as well as, other organizations locally, Roswell Park Cancer Institute, Pastor Nicholas at Buffalo Center of Health Equity, as well as others here in this community who are champions, ambassadors to really protecting the life and well-being of others. And on the national level, the African American Tobacco Control Leadership Council out of California and the Center of Black Health and Equity. And I share that because this is an effort that's happening nationally and locally, and we're all saying the same thing, and that is Black Lives Matter. Saving Black lives, is important. And, preventing the next generation of youth from becoming replacement smokers is critical, to our history, to our country, to our future. And we cannot say that, health equity matters if we don't address menthol tobacco, if we don't remove menthol, from the shelves. As you mentioned earlier, menthol was created specifically to help the poison, as some of us like to say, go down smoother, easier. You inhale, you digest it deeper in your lungs, in your body. So, it helps to mask that harshness. It helps to mask, some of the other, carcinogens and poisons that come along, with, smoking tobacco. And let's be real clear, we're talking about commercial tobacco, combustible tobacco, not traditional tobacco. So I really want to, make that clear in terms of our subject matter today.
And the thought was, before all this research and these studies came out, that menthol cigarettes were somehow healthier because when you inhaled, it wasn't as harsh.
Correct. Right.
And then you can see even the advertisement or the marketing practices. If you think about the advertisements in the 60s and 70s, you have doctors, and they're saying, it's a win-win, because it gives you a cool, fresh perspective when you're smoking it, and it's easier, it's more palatable. So, if you have a doctor that's advertising, in a magazine, so you're thinking, of course, it's going to be healthier.
Right. And one of the other, I would say, populations, I know we've been focusing primarily on the African American population, specifically to this point. The tobacco industry, they're snakes. I'm just going to call it. Okay, a snake is a snake. And in terms of their marketing and advertising, they've also targeted the LGBTQIA population, Hispanic population, other marginalized populations, specifically for profit. So when you look at their history, I think it's very telling. Even women, even like children, as I mentioned earlier, targeting or replacing those that Sara spoke to that can no longer smoke.
I'd be remiss if I didn't give a shout out to Pastor George, who you mentioned earlier. Great guy, doing a lot for the community as a whole. in Buffalo and Western New York. What are the tolls on a person and to the large community that tobacco use takes?
I think when you, and Sarah, please, I know you can speak to this eloquently as well. You know, when you look at tobacco, let's just say the African American population, over 85% of African Americans who smoke menthol tobacco. Okay, when you look at annually, that means that 45,000 African Americans die each year as a result of menthol tobacco use. Tobacco use affects every part of your body, every organ of your body. So you talk about cancer. When you look at cancer, you look at lung cancer. When you look at stroke, when you look at diabetes, or when you look at other chronic illnesses, respiratory illnesses, etc., it impacts every part of one's body.
Inflammation, diseases, it affects your eyes, your teeth. So, some people don't think, oh, well, I didn't have cancer, but they may have issues pertaining to teeth. There's tumors that grow, and I'm just thinking about even just from my family's perspective. So, no, they did not get cancer, but then they may have had like rheumatoid arthritis, which is inflammation disorders, fertility issues. So there's a lot of different things, and people just think, oh, it's just the cancer, but there's a lot of health factors or health risks solely based on smoking.
Right. And when you look at the totality, even though in terms of, say, African Americans, we may start smoking at a later age or smoke less, we die more as a result of those, exacerbated health conditions. So, this is a serious health issue, a public health crisis. And, we want to raise awareness. We want to educate. We want to help people to make an informed decision. And, at the same time, we want to make sure that we're holding those accountable, responsible, for the death and disease that's totally, preventable.
But to play devil's advocate
the devil don't need no help. But go ahead, Dad.
To play devil's advocate for a quick minute, some folks would say, why not just let people enjoy what they want to enjoy? If they're consenting adults, just let them have their smoke, basically.
Yeah, I mean, I think one of the things I would like to say is that we're not against people, or I'm not against those who smoke or utilize tobacco. We are against, the tobacco industry intentionally targeting and marketing a deadly product. When used as intended, will kill you, will kill people. So when you're talking about menthol in particular, there's tremendous health disparities in terms of 85% of African Americans that I mentioned earlier who smoke menthol. Well, less than 30% of whites or those non-African Americans smoke menthol tobacco. So there's a huge disparity there. So if we can assist those who are trying to quit and to reduce those health disparities, to lessen them, then why wouldn't we? So we have a moral responsibility to really provide an environment where everyone thrives, where our children can live a long life, and go ahead, Sarah.
No, I was just thinking when you asked that question, so, when you poll people who want to quit, 70% of people actually want to quit. There's only 30% that's actually ready to quit. So there's a very big group or percentage of people who really do want to quit. It's not like, oh, we're just, we just like to do this. People don't, the cost is, going up every day.
Right.
They're noticing health effects from the smoking. It affects, not only affects the person who's smoking, but it affects everyone around them. Because if you have children, you've got the second and third hand smoke. You have the caregivers who will be responsible for these people once they get to a place where they can't take care of themselves. So it's not just, my own decision that I want to smoke, but everyone is affected around them when they make this decision.
Right. And going back once again, when you look at its impact on tobacco, Sarah mentioned how the vast majority of people who smoke, a large proportion, do want to quit. And we do know that, for example, if let's say menthol was banned today, all right, over 250,000 African Americans' lives will be saved as a result of a ban on menthol tobacco. So this has huge implications in terms of saving lives, providing a safer, healthier environment for our children, for the next generation, and addressing the health inequities that exist and disparities as a result.
What are the next steps then? to ban menthol cigarettes locally and nationally. I know recently there was a menthol funeral in January in Washington, D.C. Stan, you were supposed to go, but due to the litany of winter storms we had in January, you were unable to go. But can you talk about the event?
Yes, absolutely. Thank you. The menthol ban funeral in Washington, D.C. was actually championed by the African American Tobacco Control Leadership Council, as well as a host of other advocates from across the country, where individuals, organizations such as myself from California to Washington to Atlanta and Wisconsin and far beyond really held a menthol funeral in Lafayette Park down in Washington, and they really was to really call on the Biden administration to really fulfill its promise. And that their promise was that to the African American people that they would make a decision to ban menthol tobacco by the end of this year. But however, that decision has been delayed, and that decision has deadly consequences, daily on the Black community. I think one of the reasons why I know for sure that the reason that it was delayed was because some of the tobacco provocateurs, lobbyists, what have you, said that, or their message was that it would cost Black votes, it would cost the administration, to lose support for another term. And pretty much those key messages was that it would create a illicit market, which a illicit market already exists for tobacco, as well as it would increase policing in the African American and the Black communities. Those are some key issues and that they need to be addressed. However, the ban on menthol really is not on criminalization. There's nothing in the ban about someone will be arrested for possession of menthol tobacco.
Right.
That's ludicrous, all right? Jedi mind trick, as we say. It places the onus on the manufacturer and on the retail sales of tobacco. So, that is fear-mongering, the gaslighting, scare tactics that has been utilized to not only with the administration, but also with the public community at large. So what we've been trying to do, and we're going to continue to do, is to really educate the community residents in regards to not just what the legislation is about, but also the impact of menthol tobacco. And in addition, to help those who want to quit to quit. So locally, what we've been doing here, fast forward, is to really look at meeting with our local councils, councilmen, our elected officials, our government entities that really can put pen to paper, to move ban on menthol forward. So, and that's at every level. So the local, city, the state, and county.
I think some people would argue that the Black community can't be any more policed. And so it's disheartening to hear that lobbyists would make the claim that more policing would occur in the Black community with trying to eliminate menthol cigarettes. You talk about putting pressure on local electeds. Now, is that going to go up the chain? Local, city, state?
It's already happening.
It's already happening?
It's already happening. Actually, we and several faith leaders from the city of Buffalo, we've actually already been on a conference call with the White House, with the Biden administration, alerting them, but sharing with them what's happening here at the local level. Since the menthol funeral, I believe that was on January 18th in D.C., since that time, myself and others, we've met with Senator Chuck Schumer. We've been in constant conversation with the Buffalo Common Council, who's developed a resolution at this point in time, and they're looking at taking some other steps moving forward based upon some of the information that we provided to them. And we believe that there is tremendous support at the city and potentially even the county level as well. So we're doing our due diligence, and I just want to really once again emphasize moving forward the importance of reaching out to our community, our grassroots organizations, to partner with them, to come alongside them, to really, show that this is a part of a movement, a national and local movement, to save Black lives.
And then I guess from the clinical standpoint with Roswell Park, when this ban takes place, what do we do with all of these people who smoke menthol and want to quit? So being able to develop content that is individualized to meet the needs of folks, who are smoking menthol, and be able to provide services for, helping them to stop smoking, providing some type of counseling and support or coaching and support, and being able to also give them the appropriate nicotine replacement therapies so that they would be effective with quitting. Because we know that with the menthol added to the nicotine really makes the quit rates more difficult. So they have a lower quit rate. And of course, we know that there's also barriers and things in place that prevent them from quitting. But then just those two ingredients together really makes it more difficult with the quitting efforts.
On the ground level, when you speak with someone who is trying to quit, what are those conversations like, and what's kind of a strategy that you plan out for them?
So basically, when we're taking them through an interview, we want to find out how much they're smoking. We want to know what their triggers are. We want to know, when and where do you smoke the most? So they give us a list of things. Well, I smoke in the car. I'm smoking when I go on my breaks. And then we're creating a list of why they may be smoking. Is it emotionally? Is it a physiological response? Or is it a situation? So we're looking at those situations, we're looking at those emotions, and we're doing a cognitive behavioral approach where we're addressing those situations and, what can you do instead, that sort of thing. We know the physiological responses, the nicotine replacement therapy is going to be the most effective thing for that because that's what it addresses. But it does not address the issues like I'm smoking when I get up in the mornings. So it's almost like a problem solving. Well, what can you do to start to prepare them for this quit date, so that they will be ready when these situations occur? Because, of course, you've started smoking, you're addicted, but then it's also become a habit.
Right.
So it's breaking habits. It's a behavioral change. So looking at, what we're doing and then breaking the chain and replacing it with something that's more healthier.
One of the things that we're going to be doing at SMC, Stan Martin Consulting, we're going to be launching a program called Free and Proud, which is a tobacco cessation program with Dr. Karen Beard out of California, who also works with the African American Tobacco Control Leadership Council, to really look at menthol specifically and look at how, as Sara described, like what are the challenges, but also what are the assets or, other tools that might be necessary to help someone who want to quit to quit. So making it a little bit more culturally and linguistically, appropriate, for folks.
Addressing the issues that are commonly found or within those particular marginalized groups and being able to address them.
So it's very important. Like we want to really emphasize. So it's not like, we don't understand or we're insensitive to that. This is a addiction. All right. And not everyone can quit cold turkey. Some people
only 4%.
Wow. You see what I'm saying?
Only 4% can quit cold turkey.
So a lot of people need more resources. So and we want to be that pathway. We want to create that access, to those services, to help those, who are, struggling.
That was Thomas O'Neill White with Stan Martin and Sara Pearson-Collins. Recently, Thomas O'Neill White caught up with Stan Martin to get an update on what progress has been made since his last appearance. Here is their conversation.
So we had you on with Sara Pearson-Collins from Roswell Park back in February, and we discussed the state of menthol-flavored tobacco products in this country and here locally, plus the adverse health effects caused by tobacco use. And we talked about how big tobacco has been targeting the African American community for generations.
Yes. Thank you once again for having me, Thomas, and it's a pleasure to be here. As you mentioned, during Black History Month, we met and, we had the opportunity to share at that particular time in terms of the national movement to end the sale of menthol tobacco and to really raise awareness in terms of how, the current administration, the Biden administration and the FDA and other elected officials have been really, delaying in terms of making a decision to end the sale of menthol tobacco nationally. This is something that has already been done, and we may even talk about this later on, but it's been done in California. It's been done in Massachusetts, Canada, and EU. And based upon, all the research and science that, we have uncovered, I would say that, with assistance from the Public Health Law Center, et cetera, we quickly wanted to pivot to shifting the conversation to locally. and amplifying that conversation, because this is something that, we don't have to wait for Washington. We don't have to wait on, New York State to do this. This is something that, quite honestly, the Buffalo Common Council as a legislative body can end the sale of menthol here in the city of Buffalo itself.
So what are the numbers? We talk about how these cigarette companies target African Americans to some degree, but like, what are the numbers with people who smoke and the demographics?
Yeah, well, let's start broadly. When you look at over 400,000 people, who smoke die annually as a result of tobacco use, which is totally preventable. When we break those numbers down, when we look at, those who identify with the Black diaspora, 45,000 African Americans die each year as a result of menthol tobacco use. So that's something that, when we're talking about.
And I just wanted to jump in real quick. Specifically from menthol tobacco use. Yes,
absolutely. Because here's the deal. When we look at, those numbers, 85% of African Americans who smoke menthol tobacco. Mm-hmm. So as a result, when you go even deeper to those numbers, 45,000 die annually as a result of directly in terms of menthol tobacco use and other correlated, health effects or diseases. So, you're talking about, cancer, you're talking about lung cancer, you talk about, stroke and heart disease. Mm-hmm. So menthol itself, and, I know that some of your listeners and others may have heard this, or maybe not, menthol sweetens the poison. It masks the harshness, and I was actually having this conversation with someone yesterday when I was doing some of my community outreach, and they were like, what's the big deal with menthol? Why is that such an issue? And I was just sharing with them in terms of it masks the flavor, it's masks the poison, what have you. You inhale deeper, it has it's easier to start and harder to quit. So, when we look at our youth in particular, going back to the harshness, the vast majority of youth, over 50% of them start with a flavored product, all right? Mm-hmm. Typically menthol. So, and we know that based upon the science that in terms of those who smoke who want to quit, in particular, we find the science shows that because of the menthol, it makes it even harder to quit. So by ending the sale of menthol, we can prevent the next generation of you from becoming replacement smokers, because you smoke, you die.
Yeah,
Unfortunately, no disrespect, that's just a harsh reality. And also, we know that it's harder to quit. So we're offering an off-ramp. And the vast majority of those who smoke want to quit. So here's an off-ramp, an exit ramp that we're trying to provide the community and help others to do so successfully.
So why do you think that the government is dragging their feet, so to speak? Right. As you say, what's the delay?
Yeah. That's
at least at the federal level.
Yeah, well, that's a question I would love for at any level, federal, state, city, to answer. And I'm gonna, just share based upon from someone who's been involved with this type of work for over 2 decades. I know it might not sound like it, but yeah, or look like it, but still, the tobacco industry, they have deep pockets.
Yeah,
they have lobbyists, they have provocateurs, and they've done their job just in terms of doing a lot of fear mongering, doing a lot of gaslighting of the issue, and what I mean by that, this is a election year. And, quite frankly, I think at the federal level that, the current administration, are fearful that it's going to cost them votes, in particular, the black votes, in particular. So I think that in addition to that in itself, with the lobbying and, the things of that nature, that the tobacco industry, just like with guns, they invest a lot of money into those type of campaigns, and therefore, the provocateurs, continue to create confusion, dissension, chaos, and therefore we continuously, unfortunately, we see delays when it comes to this particular subject matter.
Do you feel that you're fighting an uphill battle?
Actually, yes. Quite honestly, I feel that, I've always said this over the years I've been involved with, tobacco control and other health initiatives. We might not be able to match their dollars, but they can't match our will. So when I look at the different advances, going for, not to, give a history lesson, however, being involved with clean indoor air, being involved with, smoke-free housing, being involved with smoke-free parks and beaches, being involved, with other initiatives that save lives, I know that information alone doesn't change behavior. The environment has to change along with that. So, we're trying to change. When I say we, it's not just myself. It's several other community partners, organizations. I'm going to give a shout out if I can.
Oh yeah, absolutely.
To Pastor Nicholas, the Buffalo Center of Health Equity.
Yeah, Pastor George.
Pastor George, my man. And also some of the national partners that we're working with, the African American Tobacco Control Leadership Council, Campaign for Tobacco Free Kids, and the National Center for Black Health and Equity, and our local partners, Roswell Park, who we'll probably talk about later. But in addition to that, we have been able to mobilize others and at the grassroots level to go upstream. Others might want us to, wait downstream and delay and say, okay, well, let's play nice, let's save one person at a time. Whereas though that is effective, however, is not as effective as going upstream and actually changing the environment and social norms that would save millions of lives.
So playtime is over.
Yes, playtime. The gloves are off. Playtime is definitely over.
This is part of the No Menthol Buffalo campaign.
Absolutely.
Yeah, talk a little bit about that.
Yes, No Menthol Buffalo. The campaign is comprised of, I want to say we have 10 to 12 community champions, those with lived experience, smokers and non-smokers, who really believe that this is a important issue, in terms of saving lives, saving youth from becoming replacement smokers, as I mentioned, but also helping those who want to quit. We know more today than we did before in terms of the science and in terms of the harmful effects of not just tobacco, but flavored tobacco. And, this is an opportunity that others have, mobilized to come together with a shared mission and vision, to say that enough is enough. So I mean, we're looking at not just reducing health disparities among African Americans, or those identified with the Black diaspora, but also our Hispanic and Latino brothers and sisters who we know that have been targeted as well intentionally, as well as the LGBTQIA plus community.
Absolutely.
And there's I just want to pause for a moment because of the fact that these are all communities that have been underserved at some point in time, that are vulnerable, that are dealing with some of the most, have some of the greatest needs. Let me put it that way, and the least amount of resources. So what the tobacco industry does, they come in and try and play nice or try and pretend that they're a responsible business or organization, or what have you, and they're here to help. When actually all that they do is, and I'm just going to say it, just create havoc and cause death and destruction. So buying their silence or buying the silence, of our elected officials and civic organizations is unacceptable.
And that kind of ties into what you've been doing since October.
Yes.
You've gone in front of Buffalo's Common Council's Community Development Committee every single month.
Pretty much,
since October, to provide them with information from Roswell Park and the Public Health Law Center. What is the info you have shared with the council? Yeah,
so myself, as well as the others, from the coalition that I mentioned, as we've shared with information from the Public Health Law Center, who has been very instrumental in passing legislation with some of the other areas like that I mentioned in terms of California and Massachusetts,
yes,
as well as other local municipalities in terms of passing legislation in this manner. We've gone before them. We presented a policy which places the onus, on the tobacco industry in terms of, and also places the onus on the retailers not to sell menthol tobacco, it removes or absolves anyone from being in possession or smoking.
Right. You're not going to get arrested.
You're not going to get arrested, And even when I talk to some police officers, they're like, come on, are you really serious? Who has time to do that?
Yeah, right.
But, this is not that. So we've removed, I like to say, we've taken that heat out of that fire, out of that argument, So this is, once again, and if you're in compliance, with the law, then you don't have to worry about losing your business or losing your licensing, to sell other products. There's stipulations within that in terms of being in compliance and doing what you say that you're going to do as a responsible business, as a responsible entrepreneur in this community. So. The argument, I think, once again becomes whether or not they want to put, the public health over the profit of retailers and big tobacco.
Right. And what has been the council's response?
Yeah. Well, I would say this, that, definitely I would say that, Councilman, Rashid Wyatt, has been a champion, surrounding this issue. He's been very supportive. We've had some changes, in the Common Council, over the, past few months or what have you. Have. So, really bringing others up to speed and catching up, to, if you say that Black Lives Matter, you say that, the health and welfare, of your constituents matter, then here's an opportunity to put action behind your words.
And so the council is investigating the legality of trying to ban menthol.
Right. And going back to your point, one of the things that as we shared information, we've been repeatedly, told that, well, it's just something that we can do. It's just something that we, can even pursue. And, they've had, their city attorneys, look into, the legality or the power, or what are their options.
Yes.
We've been waiting. Actually, we met with them, I want to say early April. Once again, we know that they had the power and authority to do this. However, as a delay tactic, in my opinion, they wanted to do their own, which I encourage, their own research or what have you. We met with them in April, and we were told that we were going to get the findings, of that investigation or that research within 30 days. It is now July. Actually, July 10th.
It is July 10th.
July 10th. So meeting with them April 9th, you do the math. We still haven't received that information as of yet. And we know that, they're about to, go on summer break or what have you, and they won't be returning until September. So, this is just something that, I and others believe that is important. And one of our colleagues, came up with the phrase, "We ain't playing, we stand." So, we're doing, we're doing a lot of our due diligence on the ground and also at the highest level to see this come to fruition.
So, it's my understanding that there is no more. We're in July, and they go out of session in August. Is there another time between now and then that you could be back in Common Council chambers?
I think that that is our goal, to try and get back in before the recession, before that happens. But if not, it is what it is, and we will continue to do what we've been doing, and that is to provide awareness surrounding this issue, to educate the community in terms of not just of the harmful effects of menthol tobacco, but also on the importance of amplifying their voices and voting. So just as people are voted in, people can also be held accountable for not doing what's in the best interest of public health and welfare.
Is that like kind of like point one in raising awareness? Like, hey, you've got the ability to vote, so make your voice heard there first.
Absolutely, and create a platform where, as though amplifying the voices of constituents, amplifying the voices of young children. Kids, when I look at some of the, I love data, I love information. And when I look at some of the data, 280,000 youth, 18 years of age today here in New York State will die prematurely, all right, as a result of tobacco use. And connect that to what I said earlier, or shared earlier, about the vast majority, over 50% of youth who start smoking because of, menthol tobacco or flavored tobacco. All right, 280,000 people. That's equivalent to the number of residents here in the city of Buffalo itself.
The city of Buffalo.
So just imagine it. This, come on. This is a city that's vibrant. This is a city that's full of life. We're not the Walking Dead. So I think that we have a chance to, do something that is transformative, and I like to say that because some of the things that we've heard is that, well, let's wait and see what the state is going to do. Let's people are punting this down the field.
Yeah, right.
And it angers me because, we can be the head and not the tail of the state. We don't have to wait on New York City. We don't have to wait on, the Biden administration. Governor Hochul tried this, last year. Unfortunately, she didn't follow through with it, because, there was, pushback and opposition. Even though we were out here championing this, this effort, still at that time, that decision was made, to pull it back, to roll it back. However, we've continued to roll things forward.
Yeah. Could you go to state lawmakers again?
Absolutely.
And I mean, obviously, if the Common Council is doing its own investigation, I mean, maybe you talk to state lawmakers about this.
Yeah. Well, one of the things that going back to our partnership, Roswell Park, and and others, in terms of who are involved with tobacco control, that's funded by the state, New York State Department of Health, Bureau of Tobacco Control. They have legislative day each year, which I think is in February, around the parts of late January, early February. But anyway, where so they go and they speak to elected officials, state elected officials about this very issue. However, one of the things where I think there's a gap sometimes is that there's a disconnect in terms of what's happening still at the state level and then locally at the municipality level.
Right.
So that oftentimes is not a continuance.
That's government for you.
Right, exactly. So, and here it is where others such as myself and, other partners really step in. We're that bridge. We fill that void or that gap, to keep, this conversation, not just going, but going into a place where it's creating action, and it's holding people accountable for doing what they say they were going to do and accountable for what they're not doing as well.
You're listening to What's Next, and we are on with Stan Martin, founder and CEO of Stan Martin Consulting and a partner in the No Menthol Buffalo campaign. Are there any state or national events happening this summer that is related to your campaign, or just the campaign of getting people to quit smoking?
Yeah, I think one of the in terms of nationally. Some of the things that has been happening, actually, we held one of these last year. We did a no menthol funeral.
Yes.
Right. And that's no laughing matter. I'm just saying that, we've held one here in Buffalo last year, and that's something that, has been held, across this country at the national level. And that's something that, we may be looking at doing, during this, stoppage, as a way once again to raise awareness and bring it home, in terms of the impact of tobacco use, menthol in particular, here in the city of Buffalo. We know that based upon our partnership with Roswell Park, I want to say that I'm just gonna put it this way, that the number of deaths, in particular within the African American community, almost one person from that diaspora dies each week as a result of tobacco use or menthol tobacco use or related disease.
Wow.
So you figure, that's one person, mom, dad, brother, sister, sibling, who's not at the dinner table, who won't be home for the holidays, that's an empty seat at the table. So as we continue to delay and kick this and punt this and whatever you want to call it, the reality, the harsh reality, Thomas, is that people are dying.
Right. Right.
So
Plain and simple.
Plain and simple. We know that, later on this year, we have Great American Smokeout. We'll certainly be doing, something, for Great American Smokeout. We have breast cancer awareness, month or what have you. So, we're really trying to, amplify this issue and also, once again, create that off-ramp and prevent the next generation from ever starting.
As a quick aside, I don't think Great American Smokeout is the best title.
Okay.
Might attract the wrong people.
Right. That's something I would take that back from the people. Yes, I would definitely take that back. To the committee. We may come up with something else. I will share this though with you. We've been locally, if I might add.
Yeah.
Please. We've. As a result of our funding from the Campaign for Tobacco-Free Kids Action Fund, we've been able to offer, many grants to youth-serving organizations as well as faith-based organizations to really do what we cannot do alone. And that is really, mobilizing youth, to push back against the tobacco industry, to come up with some of their own counter messaging, counter marketing, of what it means to live a healthy, long life. Working with faith leaders, working with, as I mentioned earlier, Pastor Nicholas, Reverend Kaiser Pointer, as well, to amplify and engage, our faith leaders, in this effort. We're also been able to provide some seed funding as a result of these mini grants to Hispanic Heritage Council, working very closely with Kaz Rodriguez, a good friend of mine is over there.
Yes, good friend of the show as well.
Great, yes. And others, fraternities and sororities and just other like-minded organizations, from the community that have been deeply impacted. Everyone probably has or knows someone who's been affected by tobacco use.
Yes.
And when you look at that in one shape, form, or another, so really, mobilizing and bringing, people and organizations and leaders, real leaders together, that you don't sometimes hear about, to once again do what we cannot do alone, has been really, really rewarding and also purposeful.
This is as grassroots as it gets.
Yeah,
it really is.
Thank you.
And uplifting the youth voice. I can't tell you how many people I've interviewed who have that as one of their top priorities, elevating. If it's affecting the youth,
right, we
need to hear from the youth in their own voices, in their own way.
Yes. So I'm excited about that, and even though No Menthol Buffalo, and under the umbrella of Stan Martin Consulting LLC, we've been bringing the youth together surrounding this issue, and the community is going to be hearing from our youth ambassadors over the next few months to come.
Oh, great. I would love to have them on.
Absolutely.
I have this question. Roswell is such a powerful institution here, and even on a national level.
Right.
Could you lean on them a little more, to lean on our politicians?
Right.
Is that something that can be done? I don't want to put Roswell on the spot or anything like that, but they hold so much sway, I think.
Right.
In this area and across the state.
I'll be honest with you, Thomas, and I'm very unapologetic, when it comes to this particular subject matter, this topic, and saving lives. I think there's more that Roswell can do. I think there's more that the mayor could do. I think there's more that the Common Council could do. I think there's more that community can do. Mm-hmm. Myself included. So I'm not absolved. So
okay.
Certainly I think that as we're at a tipping point right now. When it comes to this issue, and the fact that when you ask the question, which I appreciate and respect, can others do more? And I would encourage our listeners, whether you're an individual or organization, to answer that question yourself. What can you do, what more can you do, to really save lives? Because I want to go back to, the fact that this is the number one preventable cause of death and disease. Preventable.
Yeah, preventable. That's the key word.
So so whether it's someone like Roswell, or even elected officials to the highest level in this city, from the mayor on down, to the common council, to community residents, community voices, this is something that we need not to ask, we need to demand, quite frankly. Because you can only hold a group of people down for so long before they really start to, demand the change that, they deserve. We
Right.
talk a lot about equity. We talk a lot about, the social determinants of health. Okay, well, I'm a big one on just, in terms of creating a world that's, that's equitable, but also one that is just. And, when I sit in the Common Council and I, watch, and we stand, and we take, we go through the Pledge of Allegiance and the oath and things of that nature. Those last words, justice for all. Well, what justice is there in this right here, when you know that people are dying, and you know that you have the ability to put pen to paper to save lives, and you don't? Where's the justice in that? There is none.
It's powerful. That is powerful. Something that came across our desk recently was New York State Quitline has a new website section and services focused specifically on helping folks cut down or completely quit commercial menthol tobacco products. Seems like a step in the right direction. What are your thoughts?
I think that's excellent. Once again, I think Roswell, this is an example of them saying, hey, what can we do? What can we do more of? So I think this is a direct result of the work that we've done over the last year, and also that others funded to advance tobacco-free communities, Roswell included, have are showing that their willingness to get in the fight. I think that when you look at people of color, and you look at, I'm going to say specifically, African Americans, their success rates in terms of quitting are not as high as other, ethnic groups.
Does access play a part in that?
Access, and also, you have to look at some of the historical trauma, some of the, other factors that, in terms of the medical history, medical trauma, that, African Americans don't have a lot of faith and a lot of trust in. And then in addition, tobacco is one of those, and this is part of the conversation that I had with one of the persons who was visiting our outreach table. People think that, well, I can quit at any time, when it comes to tobacco, especially young people. I'm going to smoke up to this point and then I'm going to quit.
Right.
Right. And before you know it, someone is addicted, someone is hooked on it. And we're not, we're not against those who smoke or those who, are addicted to tobacco use or use tobacco. But we are against the tobacco industry, intentionally targeting, people in vulnerable communities.
Yeah, you're targeting the system,
right?
Not the person.
Yeah. And at the same time, recognizing that, it is hard. It takes 7 to 9 or more times to quit successfully. Young lady told me yesterday that her brother, it took him 21 times.
Wow.
And those stories are not outliers, that's, a lot of people can identify with that, who might be listening or know of someone. So, we going back to your point, there's more that we can do, and it starts with not just looking at individual change. It also has to create, the environment has to create the change that is necessary for those who want to quit and to be successful.
But it also must feel good, or you must feel a sense of accomplishment to see that what the Quit Line is doing, and say, oh yeah, well, we helped build that up.
Absolutely. I mean, I'm looking forward to continuing to partner and work closely, with Roswell Park and others, because we know that, and they've been in this game a lot longer than I have, because we know that every advance that we make, our every success, the tobacco industry is already, like 10 steps down the road on that.
Right.
So we're going to enjoy it.
It's almost like a good criminal being against the cops.
Right.
They're staying 3 or 4 steps ahead.
Right. So we're definitely going to celebrate, and we're going to enjoy this victory right here, and we're going to enjoy our wins and celebrate our successes as well. And at the same time, we're going to keep our, what's that phrase? Keep our foot on the pedal, metal to the pedal, what have you.
Yeah.
And move forward.
So then where do you see this campaign in 2 to 3 years?
Well, 2 to 3 years.
Where can you expand?
Yeah. Hopefully by next year we have menthol off the shelves. Next year being January 1 of 2025. Hopefully that will happen. But before then, hopefully over these next couple of months, we'll be able to, really have some conversations with the Common Council, whether it's one more time before they go out on break or when they return in September, that this type of legislation will go to vote, and we'll see where people stand, and we will hold those accountable who stand against us, who stand against saving lives. You can't say that, that your constituent lives matter. You can't say that, you're about saving children and concerned about their health and well-being, and vote against this legislation or such a policy.
Yeah, is there a plan if the Common Council comes back to you and says, our hands are tied? Sorry.
Yeah. Well, if the Common Council, does that, then we'll have to take a look at some other measures, some other strategies that we do have in our toolbox, to move forward on. Absolutely.
That was Thomas O'Neill White with Stan Martin. If you missed anything or want to hear it again, you can get this program as a podcast wherever you get your podcasts, or on the Amplify BTPM app. Each episode is online at WBFO.org. I'm Jay Moran, and thanks for listening.